This show was produced by and first broadcast on Radio Kidnappers, Hawke's Bay's community access radio station. Thanks to New Zealand On Air for enabling us to put Hawke's Bay voices on air.
Good morning, everyone. This is Heiko from the Acupuncture on Air show at Radio Kidnappers, where every Tuesday I interview acupuncturists from around New Zealand. Today we're going to be talking with Nicola Douglas, who practices outside or practices out of New Plymouth. Good morning, Nicola. How are you?
Good morning, Heiko. I'm good, thanks. Thank you for having me today.
Well, good. You're handling the lockdown and everything with four kids in the house?
Yeah, hopefully no one's going to burst in here. No, it's been nice, actually. The weather's been amazing. Yeah, it's been good to just get some study done as well.
Great. Now, listen, before we start and we specifically talk about, your speciality, which is the treatment of gynecology disorders, in particular fertility, so tell us about your what I say is your other life before you actually started to study acupuncture, and what made you decide to study acupuncture?
Well, in my other life, I was a registered nurse, and I trained to do that when I left school. And at that time, when I finished training, there were not a lot of jobs around in New Zealand. And so I went to Singapore and worked for a year. And then after that, I went to London for a year and still nursing. And then I moved to Perth. And in Perth, I was there for 6 years and came across an ad to learn to do acupuncture. And I thought, wow, that would be amazing. I could help a lot of people treat pain with acupuncture. And so I really didn't know a lot about it. And when I went into this course, it just opened up my mind to what really Chinese medicine could do. So I did think I'd left Western medicine behind me completely because I was so into the Chinese. And then I moved home, bringing acupuncture with me.
And when you say you moved home, it was back to New Plymouth?
Yeah, so I moved back to New Plymouth. I'm actually from Hawera.
Right.
And I didn't really want to go back to Hawera, and New Plymouth was just an hour away, and it's beautiful, it's on the beach, there's more people, and a lot to do. It's just a really nice place.
No, it's a lovely spot. Now, listen, and now you, of course, you have a specialist interest in treating, women's health problems, in particular fertility, but when you started, you were planning just to treat pain, or that's what you thought acupuncture was its main focus. I mean, so how did you get into treating the women's problems? Did you sort of plan that, or that just evolve?
It was definitely an evolution. I learned a lot about acupuncture and pregnancy when I moved back here and started following Deborah Betts, and then I was pregnant myself, so I really got interested in the pregnancy side of it. And I was surrounded by a lot of pregnant people, and I was meeting a lot of midwives, and so I got to do a lot of that, which I really loved. And as I was treating a lot of pregnant women, people started finding me for fertility. Mm-hmm. And I was thinking, I really don't know much about this. But I trusted the process of TCM, and I knew that as long as I could diagnose, I could treat these people, and I would just sit with them, hear their story, make the diagnosis, and find a herbal formula that fitted that pattern, and things started working. And it was just and it was hard, and I have to say, in that time, I have thought about stopping it sometimes because it can be hard, but it's just such a calling, and I really love working in women's health because I just love my clients.
Fantastic, yeah. Now, what type of clinic are you working from in New Plymouth? Are you working in a home-based clinic, or are you working from a centre with other practitioners?
Yes, we have a multidisciplinary clinic in New Plymouth, and it's got 5 clinic rooms. It's called Tahi, and we're so lucky to have a pelvic health physio as well, and a naturopath. We've got a few wellness coaches. There's meditation and yoga going on, and then we've also got another acupuncturist too, which is the first time I've been able to work with another acupuncturist, and so that's really cool for me.
And what does your other acupuncturist, is he doing fertility work as well, or?
So I'm working with Jeff Silver, and he does a lot of everything really. He doesn't particularly specialise in anything. He does like to do tricky long cases, anything that's chronic. He really likes to sink his teeth into. Okay. I really like having him there because I can send my fertility guys to him as well. So we've teamed up as a bit of a fertility team, you might say too.
Oh, great. Oh, it's good that we've got, so I have to get him onto the show as well in the future. But yeah, let's just get into the treatment of fertility with you, and particularly, your approach, or the Chinese medicine approach. Now, I think you mentioned that you combine acupuncture and Chinese herbs.
Yeah, I do. I've found that working with the Chinese herbs it brings about really good results, and I like the fact that people are treating themselves every day with the herbs. So I think that's just a really good combination. And with fertility, the herbs are really, really important. Yeah,
but the thing is, I know in my own practice, particularly, from patients, they really worry about mixing herbs and also taking, modern pharmaceuticals. And even though I know that this is just the norm in China, and it's like, millions of people are doing it, but now what about in New Plymouth? Like, for example, if you've got a female patient, she might be taking clomiphene for fertility, and then, you come in and want to prescribe, for example, tonic herbs or, kidney herbs. Do they worry? Do they go to the doctor? How do you get around that?
Okay, so I do like it when they question that, because we do have to be considerate of the Western pharmaceuticals that they're taking, because the pharmaceuticals are so strong, and depending what we're trying to do with our herbs and other treatments, we don't want to strengthen that activity so much as well, and we also don't want to go against what that pharmaceutical is doing. So normally when I explain how that drug is working within the body and how the herbs can work with that drug, people don't really worry. As long as I can explain it, and I do say to them, if you want to check it out with your doctor, feel free. Doctors do know that I prescribe herbs as well. Right.
Now, what in your clinic? I mean, with particularly the fertility, are these patients also undergoing IVF, or they're planning to, or are you getting patients that maybe IVF has not been successful, or the waiting list is a year before they get on, or what sort of patients are coming through the door?
Yep, all of those ones, definitely. People who have had IVF 5 times and it hasn't worked, people who are thinking about doing IVF, people who have been trying and don't want to do IVF, people who are just preparing for pregnancy generally and just thinking maybe something's not quite right. I just want to make sure my body's functioning really well before I get pregnant. So all of that, people who are going through IVF, they have acupuncture through that process as well. So everybody at any stage, I see them all.
Right. Now, I understand I think patients are fortunate there because you're utilising the best of both worlds. I mean, you've got all your nursing and Western medical background as well as redoing it all again when you went to college, acupuncture college, and then you're using ancient acupuncture and herbal, empirically true, tried and tested formula combinations. But when you're involved in doing like the latest things what we have in modern medicine, such as charting the temperature, the ovulation, monitoring their hormones. Can you tell us a bit about how you do that? In particular, maybe something to do with the temperatures when the patient's taking their temperatures and how your treatment is applied.
Yeah, sure. For me, the basal body temperature, getting people to chart their temperatures is absolute gold standard information for me. Mm-hmm. It translates really well Western medicine into TCM in a picture that you're looking at. I just love it. It can show up for me a little part of a diagnosis, perhaps that I'd missed when I was questioning that patient, because that temperature can't lie. I can see it there every day for however long their cycle is. And generally when you're looking at it, you can also see what's going on with the hormones too, because that first half of the cycle is more yin or cooler, and so the temperatures should be a little bit cooler. And that's to do with estrogen. And then around about halfway, someone should ovulate and progesterone kicks in and it heats the body up. And so you should see two different looking phases in the cycle which relate to the yin and yang and estrogen and progesterone. So I really love how that marries together.
Right. Now, of course, the $1 million question, and the answer is probably, how long is a piece of string? But, is there a rough time that can be advised for patients when you're working with them on a fertility journey? And I know in China, I've read some of the stats, we're looking at roughly a 12 to 18-month course of herbs is a sort of a standard sort of time. But what about you? What are you finding, or what can you try to recommend to patients?
I would love it if people wanted to come to me for 12 months before they were conceiving. I could imagine what you could do with those bodies.
Yeah.
But here, at a minimum, 3 to 4 cycles, because that is the time for two things. For sperm and eggs, they both need around about that time to mature. So whatever you're doing today impacts your fertility 3 or 4 months down the track, right?
Yeah.
And if someone comes in with a cycle that's really not conducive to support pregnancy or to even get pregnant, to allow 3 or 4 cycles to see those changes and because getting pregnant is not the end goal. The end goal is having a healthy baby, right? So giving our bodies that amount of time where it is functioning at top notch to allow better outcomes.
Yeah, because what I sort of have a thing where I say is you want to actually have a minimum of 3 menstrual cycles in a row that are healthy, good, on time, without pain, blah blah blah, as a sort of an indicator of where you can go. So now, but what about you mentioned about the partners and things too. Are you finding you're getting many the partners coming in for treatment as well?
Oh, they are so hard to get through the door.
I usually get them once, usually because their partners nag them to come.
Yeah, sometimes their partners can make them come, and that's not always the greatest thing too.
Yeah, I know.
Sometimes it's just about sowing seeds and just allowing them to make that decision on their own. But now I've got Jeff working with me, and so they're a lot more open now to coming to see a male acupuncturist. So that is getting them in the door. But it's so important. Just actually lately, I've had a few women who have been working with me for 3 or 4 cycles, and they said to me right from the get-go, my partner will not have his sperm tested. He will not come for acupuncture. He thinks it's a load of crap. Mm-hmm. And it's taken this long for them to finally go and get some testing done, and their sperm is pretty in dire need for work. And it's so important that these men get on board and get tested and become part of the treatment.
Right. Well, listen, Nicola, so we better finish up here, and and good luck with trying to get a few more male patients in the door to help your success rate. But yeah, thanks for being on the show. But could you just give us your best phone number so that people in New Plymouth are able to contact you?
My best phone number is 021 468 805.
Okay, great. Thanks. Now, I'll also put a link to your website in the comment section on the YouTube, and so that people can go there and read a bit more about it. And so thanks again for coming on the show, and we're going to finish the show with a song. Well, here we go, and thanks very much, Nicola, and we'll see everybody on the show next time. Thank you.
Thank you.
Dirty old hole in the side of the road for the man who cleans the streets. Open pub doors where the working class goes at night. Written on walls where the cats never crawl for the glass along the top. Man, I was born there, I'm gonna walk right back. Cost a fine town, it's a fine town, I'm coming home. I feel so lonely, I've been too long away. Cost a fine town, it's a fine town, I'm coming home. I wish I'd never made up my mind to stray. Nobody owns all the dirty old clothes that are lying in the lane. Whistling loud, the 4:30 shift has gone. Little old man with a pole in his hand, lighting lamps along the way. Hurry me back there, I wish I'd never gone. Cost a fine town, it's a fine town, I'm coming home. I feel so lonely, I've been too long away. Cost a fine town, it's a fine town, I'm coming home. I wish I'd never made up my mind to stray from Cost a fine town, it's a fine town, I'm coming home. I feel so lonely, I've been too long away. Cost a fine town, it's a fine town, I'm coming home. I wish I'd never made up my mind to stray. Cost a fine town, it's a fine town, I'm coming home. I feel so lonely, I've been too long away. Cost a fine town, it's a fine town, I'm coming home. I wish I'd never made up my mind to stray.
Enabling us to put Hawke's Bay Voices on air.